Dear students, sternal angle of Lewis, it is the angle between the manubrium and body of the sternum. Let us learn about this angle and its clinical importance. At the end of the discussion, you should be able to answer the following questions. That is, what is sternal angle? How do you feel the sternal angle? Name few important events that take place at the sternal angle and the clinical importance of sternal angle. The manubrio-sternal junction is also known as the sternal angle, and the other name for the sternal angle is the angle of Lewis. So this is the junction of manubrium and body of the sternum, where the two parts are set at an angle. So the angle between the manubrium and body of sternum is known as the sternal angle. In this picture, you can see the angulation between the manubrium and the body of sternum you are seeing. So this angulation is about 163 degrees. It is felt in all individuals and it forms a surface landmark of anatomical and clinical importance. In this picture, you can see the junction of the manubrium and body of sternum, that is the sternal angle, and you can see the attachment of the first rib and second rib to the manubrium. So the surface landmark for the sternal angle of Lewis is it is felt 5 centimeters below the suprasternal notch, and it felt as a transverse prominence. It marks the junction between manubrium and body of the sternum, and its level corresponds to second costal cartilage anteriorly and to the intervertebral disc between the 4th and 5th thoracic vertebrae posteriorly. Now the question is, how do you feel the sternal angle? First, you identify the suprasternal notch, that is jugular notch, which is seen as the upper border of the manubrium sterni in the midline of the neck. So then pass your finger down along the manubrium about 5 centimeters until you feel a distinct transverse bony ridge. That is the sternal angle. The second rib is continuous with the sternal angle. So slide your finger down to localize the second intercostal space. Hope now you know how to feel for the sternal angle. The important events that take place at the sternal angle can be summarized in the mnemonic Rad-Bland, of which the R stands for the rib. So the second rib corresponds to the sternal angle, as the costal cartilage of the second rib articulates with both manubrium and body of sternum at this point. This is used as a landmark for counting the ribs. The ascending aorta ends and the descending aorta begins at this point. Not only that, the beginning and ending of the arch of aorta, you can say, is at the sternal angle, the trachea bifurcates into two bronchi at this level. The pulmonary trunk shows bifurcation at the level of sternal angle. The left recurrent laryngeal nerve and ligamentum arteriosum can be identified at the sternal angle. The azygos vein drains into superior vena cava at this level. The cardiac plexus of nerves are seen at this level. The thoracic duct crosses from right to left at sternal angle. These are some of the important events in brief. The expanded list of anatomical landmarks at the sternal angle of release, or it forms the plane of separation of superior and inferior mediastinum. The arch of aorta begins and ends at this level. The ascending aorta ends. The descending aorta begins at this level. The trachea divides into two principal bronchi. The azygos vein arches over the root of right lung and opens into superior vena cava at the level of sternal angle. The pulmonary trunk divides into right and left pulmonary arteries at this level. The thoracic duct crosses from right to left side and reaches the left side at the level of sternal angle. The sternal angle corresponds to the upper limit of base of heart. The cardiac plexus are situated at the level of sternal angle. The ligamentum arteriosum is located at the sternal angle. The left recurrent laryngeal nerve passes under cover of arch of aorta at this level. This corresponds to the intervertebral disc between 4th and 5th thoracic vertebra. The second costal cartilage lies at the level of sternal angle, so the ribs can be counted from this level to downwards. The sternal angle is the meeting point of manubrium and body of sternum, that is manubrio-sternal joint, which is a secondary cartilaginous joint. And the sternal angle is used as a landmark for understanding the pleural refractions. Coming to the clinical application of sternal angle, the sternal angle is the referral point for measurement of jugular venous pressure. So the jugular venous pressure is the most accurate estimate of the right atrial pressure, the volume status, and cardiac function. Coming to the measurement of the jugular venous pressure. The positioning of the patient should be placed at 35 to 45 degrees angle as shown in this picture, and head end has to be elevated and it should be in the semi-Fowler's position. Coming to the observation and measurement of recording, the oscillating column of blood in the right internal jugular vein can be best visualized at an oblique angle. First horizontal line should be at the level of oscillating column of internal jugular vein pulsations. Then the second horizontal line is at the sternal angle as shown in this picture. The vertical line connecting the first and second horizontal lines is about 4 centimeters in length. And the sternal angle is 5 centimeters from the right atrium. So, the distance from the right atrium to sternal angle is 5 centimeters, and the distance between the sternal angle and the upper column of internal jugular vein is 4 centimeters. For calculation of jugular venous pressure, the two values has to be combined. That is, the vertical column of 4 centimeters above the sternal angle and the distance of 5 centimeters from the sternal angle to the right atrium, making a total of 9 centimeters is the jugular venous pressure. Now you have understood the importance of sternal angle, how to feel for the sternal angle, the various anatomical events that take place at the sternal angle, and its clinical application.